we're coming to the end of our discussion, but I want to give you both a chance to say any final words about where you think our kind of work is going, or where you'd like it to go, or anything else that you think would be interesting to people who are considering a career doing the kind of work that you both have done so well and impactfully over the last, well, not I don't want to say how long, but in the past you have done and continue to do this important work. Any final words to future legal epidemiologists?
Well, Scott, I was just thinking of sort of the two bookends in my career in terms of, what you could probably call public health law research all along. And just, I'm struck by the difference between where I started and where I am now. And this may have some implications for where we go forward. But, I'm remembering when I first started out, my first project was this project to estimate the need for mental health services in all of these priority populations in a large southern state. And we applied this very complicated statistical model called horizontal synthetic estimation. We went and presented the results to the mental health authority leadership team. They were very impressed with it, but they pushed back because the deputy commissioner said the number of people you're estimating who need mental health services in the highest priority is too high, too many people. And I said, well, what number did you have in mind? And she said, well, we were looking for a number that would pretty much match the capacity of our state mental hospital system. Now, that makes sense now when I look back on it, because they had no interest in us identifying all this need that they had no capacity to fulfill. So they wanted us to fuss with our criteria so that we could actually give them a more acceptable answer. And I thought at the time that all you would have to do as a researcher, you're sitting up on this hill and you come up with this wonderful study and you push the boulder down the hill and it rolls down, and by sheer force of gravity, it's going to affect policy, and that's going to affect people, and it's going to improve the world. And what I realize now is that we're at the bottom of the hill sometimes, pushing the boulder up. And we have all of these pressures on us, but we just need to keep doing that. And now I'm just looking back the last few years, I've had the privilege of seeing my research, used to enact a new and I think very promising intervention in the area of gun violence prevention, the Extreme Risk Protection Order. When I started and we studied 2 states, and we produced this finding that for every 10 to 20 of these legal actions of a risk-based firearm removal, 1 life is saved through averted suicide, and it was presented in an easy kind of number needed to treat way. We put it in the hands of policymakers coast to coast. I got out there and I participated in dozens of forums all around the country with law enforcement people, with state legislators, with academics and family members and advocacy groups. And we went from having 2 states that had a law like that to now 20 states and 19 in the District of Columbia. Now we have a big implementation problem. But that was a direct result of learning kind of how to do this and how to talk about it in a way that is very gratifying. So I think we need to be inspired by the stories of success. I'd like to go back to our critical opportunities paper published in Milbank and look at those 5 areas and see 8 years later what's actually happened, in those. And I think we would. There's going to be a mixed bag. There are many, many more people, talented young scholars who are going into public health law research, legal epidemiology. I think that's going to translate into a bigger benefit for the field. So we keep on keeping on. We have to be in this for the long range.
Alex?
Well, I think one important point that after doing this for whatever 4 decades, that I think turns out to be really important in terms of having one's work have a real, an impact on society, an impact on science. And that is strategically choose what to study and when to study it. I think that's really important. Think of the big picture right? We need to think of the big picture about society and where we're at, and think about how we know diffusion happens. And when a new innovative law is being tried in a couple of places, a couple of cities, a couple of states, or whatever, if you think that it's based on strong theory, it's a pressing social problem, and it may work, even though the sample is small, it might be a little harder to study, it might be a little bit harder to get published, but the time is right, right? I mean, that's an opportunity, and study that example, because those early studies that show, oh, the state that tried this, and it was shown to be significantly effective on an important health or social problem, that feeds into the diffusion to the other states. And then after 20, 30 years, the whole country or multiple countries in the world have a particular law or policy in place that started somewhere. And that early research was central in nurturing it along from the first couple of places that tried it, and gave it a base to say, this is effective. You know, this looks like it's significantly effective. And that's how to have a career. I think that when you look back over decades, the large impacts that's how they started.
Well, those were inspiring words, and I think I want to add just a few glosses on them. You know, I'd like to be in a world, and I think we should be fighting for a world in which those people who fund and support research are investing in helping us identify those important questions as quickly as possible. When legal innovations roll out in life, to evaluate them as quickly as possible, to learn what we can about their implementation, to treat that as an urgent problem, to make sure that the treatments we are launching upon millions of people for who knows how long are effective and don't have negative side effects. You, in your work, and as you've discussed in this hour, have shown that we can actually do rigorous research to discover what these laws are doing. We can be confident in the results that we get about the effects they're causing. We have, I think, made clear in this conversation, as we have in our work, that the full range of social psychological, sociological, economic, epidemiologic theory can be drawn upon to help explain and study and predict legal related phenomena. And that we're, far from starting from scratch in this field. We are actually standing on, shoulders of German-speaking giants like Max Weber and, all the subsequent researchers in social and behavioral health down to today. We know that right now, too little attention and too little investment is given to our kind of work. We know that some of that comes from methodological parochialism and bias. Some of it is tradition, some of it's politics. And yet we can't imagine, I think I can say, a more important way to spend one's career than doing this work. And I think that's what I want to point out or highlight to our audience as we finish. You are looking at doing public health law research or legal epidemiology, and hopefully you are now convinced that it's worth doing and that it can be done. But you're perhaps a little daunted by the challenge of finding a way to do it as a career. I think the remedy for that, or the treatment for that, sense of challenge is what you see in Alex and Jeff, the passion to answer important questions that are going to matter to the health and well-being of millions and millions of people. And if you can keep that passion, you will have the greatest chance of convincing the doubters that they should give you their data, give you their money, give you their attention, and follow your advice, because that's the bottom line. Societies as big and complex as ours, facing the kinds of problems we have, just can't afford to mess up in dealing with those questions. We've seen that with COVID. We've seen a year in which existing knowledge about disease control and about health communication and about leadership and about vaccine distribution and so on just hasn't been applied. And the results are dire. And this is just one of our problems. As we move forward into climate change, we talk about the opioid epidemic, as we talk about gun violence, as we talk about the ongoing effects of continuing racism. All these are problems we just don't have the luxury to screw up on. And that means that although research doesn't determine political solutions and doesn't always even drive political solutions, it's still the best resource for intelligent political solutions and still a resource for changing social attitudes and helping people see why solidarity and mutual concern and mere rationality are actually the pathway towards a good and successful social life. So we will keep doing this, gentlemen, I know, and we hope that all of you watching will continue on the path you're on to add to this important body of work. So I want to thank you all for attending this keynote presentation. I want to thank you all for watching other presentations in this series and in the growing library of important resources on legal epidemiology and public health law research.